Hospitals across the country are in panic with record level delays and a record number of patients. Here at Middlemore Emergency Department, 71 patients were waiting for a bed over just one night last week. Meanwhile, a 50-year-old woman has died with a brain bleed after allegedly being told by staff that there would be an 8-hour wait before she was examined. Emails recently leaked to the Herald showed the South Auckland ED saw more than 420 patients 2 nights in a row. Normally they see 300, shifting the hospital to code red. Elsewhere, the Waikato Hospital ED has been operating near capacity for the past fortnight, and it's leaving medical staff across the country exhausted.
When you're working in a already pressured environment, and the expectations to continue to keep working and working and working, you really don't stop and look at how enormous this is. But it is, and we've said this for a long time now, this is critical and at breaking point, and many of our nurses are reporting being broken themselves.
Although COVID has played a large role in the hospital overload, so has the flu season, with many people presenting with acute respiratory illnesses. Health Minister Andrew Little recently said he hadn't seen any figures to support claims that emergency departments were seeing record numbers of patients, though. He said in a statement to the Herald, while hospitals were under pressure, as they were every winter, they were coping. But the Nurses Association's urging those in government to remember what's at stake and want greater support for burnt-out staff.
What we must not forget is that it's people at the centre of this. And as healthcare workers, we've always said, people are at the centre of the care that we provide, whether you're a doctor, a nurse, the orderly or the healthcare professional or the kaimahi. Patients are always at the centre of the care that we're supposed to be providing. So any impact on the quality of care that they should be expecting and we should be delivering certainly needs to be addressed. Having some dedicated support to provide supervision or mentoring for these health professionals. And as I say, even the orderlies and security, because everybody takes responsibility for the sector when they're at work. So providing that sort of emotional and patient and person-centred care, I think, is really important.
Thanks for checking out our YouTube channel to stay up to date with all the latest news from the New Zealand Herald. Click the subscribe button below or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.